Let's learn about bipolar disorder. Bipolar disorder is a mental health condition formerly known as manic depression, characterized by the unusual shifts in mood, energy, and functioning. Onset may begin with manic, depressive, or mixed set of manic and depressive symptoms. Most patients describe their first symptom as depressive-like symptoms. Approximately 0.6 to 2% of children younger than 18 meet the diagnostic criteria for bipolar disorder. What causes bipolar disorder? The definitive cause is unknown. Biological influences include structural changes in the third ventricle, the white matter, the prefrontal cortex, the amygdala, and the basal ganglia. Risk factors. Bipolar disorder tends to cluster in families. Children who have parents diagnosed with bipolar disorder are more likely to develop it themselves. Most common onset is 15 to 19 years old. There is no increased incidence among race, ethnicity, or sex. Children with ADHD seem to be more vulnerable to bipolar illness. Psychostimulants and antidepressant medication can precipitate a manic episode. Bipolar disorder has both manic and depressive symptoms. Some manic symptoms include feeling very up, high, elated, extremely irritable, feeling jumpy or wired, having a decreased need for sleep, talking fast about a lot of different things, racing thoughts, feeling able to do many things at once without getting tired, having excessive appetite for food, drinking, sex, or other pleasurable activities, feeling unusually important, talented, or powerful. Depressive symptoms include feeling very low, sad, anxious, feeling slow, down, or restless, having trouble falling asleep, talking very slowly, feeling unable to do anything, having trouble concentrating, making decisions, feeling unable to do even the simplest things, having a lack of interest in almost all activities, feeling hopeless, worthless, or thinking about suicide. According to the symptoms you're describing and what your mom and teacher have reported, it marks a lot of boxes for the diagnosis of bipolar disorder. The DSM-5 states that the criteria for bipolar diagnosis is both symptoms of depression and mania. To be considered mania, the elevated, expansive, or irritable mood must last at least 1 week and be present most of the day, nearly every day. To be considered hypomania, the mood must last 4 consecutive days and be present most of the day, nearly every day. During the period, 3 or more of the following symptoms must be present and represent a significant change from usual behavior: inflated self-esteem or grandiosity, decreased need for sleep, increased talkativeness, racing thoughts, easily distracted, increase in goal-directed activity or psychomotor agitation, engaged in activity that hold a potential for painful consequences. There's also a depressive side of bipolar disorder, and the DSM-5 also states that they have to have 5 symptoms to be diagnosed with a major depressive episode. So since the symptoms closely align with the criteria, I would like to refer you to a mental health expert for further evaluation and tests. To diagnose bipolar disorder, a provider must conduct an interview. A physical examination and lab can also be helpful. While bipolar disorder can't be seen on blood test or physical exam, these tests can help rule out other illnesses that can resemble this disorder. Some differential diagnoses that can present similarly that should be ruled out are a head injury or tumor, hyperthyroidism, substance abuse, ADHD, and anxiety. Treatment can include cognitive behavioral therapy, medications like mood stabilizers, antipsychotic medication, and to a lesser extent, antidepressants, self-management strategies like education and recognition of an early episode's symptoms. Complementary health approach can be aerobic exercise, meditation, faith, and prayer, but this does not replace therapy.